So with that, welcome everybody. I would love to call this March meeting of the Outreach and Engagement Committee to order. The time is 9:02. Stephanie, would you please take attendance?
Yes, thank you. Good morning, everyone. Ava Bermuda Zimmerman.
Good morning. I'm present. I'm driving, so I'm going to be off camera.
Thank you very much. Isha Canada.
Present. Similarly, I'm driving. I'll be off camera as well.
All right, thank you very much. Adrian Cochran.
Happy dreary first day of spring, present.
Thank you, Adrian. Good morning. Sheila Hummel will not be joining us. Molly Weston Williamson.
Present.
And Justin Zartman.
Present.
Thank you. And we have a quorum.
Thank you so much. Thank you, Stephanie. I want to acknowledge if we have any members of the public joining us today. We're excited to have you. And first on our agenda is review and approval of the January 16th, 2025 meeting minutes.
So moved.
Thank you, Ava. Any discussion?
We just need a second.
Okay. It's in the agenda as discussion.
Okay. Sorry.
Second the discussion. Is there a second to approve the minutes from January?
Second.
Thank you, Adrienne. Now, is there any discussion? Okay. All in favor of approving January minutes, please say aye. Aye.
Aye.
Any opposed? Any abstentions?
I'm abstaining. It's absent.
Yeah, this is Isha. I'm abstaining as well. I think I was absent.
Okay. I hear two abstentions. I think the motion still carries.
Yep.
Okay. Thank you so much, everybody. And we're going to move us along to the legislative update.
So actually, I'm going to do that because we put it on first so that Maddie could come and then run over to the Capitol, but then the Labor Committee changed their meeting time from 10 to 9. So that's where she is. Okay, so we've been tracking several dozen bills. The one that we're focusing on most particularly this year is Senate Bill 1427, an act expanding paid family medical leave insurance program benefits to certain school employees. The idea behind this bill would be to provide access to paid leave and, with the substitute language, Connecticut FMLA, to employees of public and private schools who do not have a certification or license. So this includes the paras, the cafeteria workers, bus drivers, library aides, clerical staff, etc. I testified in support of the bill on March 4th. It is on the Labor Committee agenda today with substitute language to add the job protection under Connecticut FMLA. It also tweaks the language a little bit to show that if you are in a position that requires certification or license, you are excluded. But if you are in a position that does not require certification or license, you are in the program. This is really intended to simplify administration, make sure that folks who may happen to have certification but don't need it for their current job, such as individual who worked for a public school as certification and now works for a private school which doesn't require it, they would still be participating in the program. So we'll see how that goes. The labor chairs are very much in favor of this bill. This is a priority for them. So we're just working with them to make sure that the language is correct and gives us the abilities to administer the program if it does go forward. And I think it's like happening right now. In terms of other bills that we're watching, there aren't a lot that affect us this year, but there are some that affect us as a program, but some affect us as a quasi-public. So we're watching those to make sure that we know what we're required to do. And committees are finishing up their work right now. Every committee has to get their bills out within the next 2.5 weeks, except for appropriations, which doesn't affect us. So we're just working to see what what comes through and then what amendments will be filed before session ends in June.
Thanks, Erin. And it's always happens that you can't give the legislative update because you're too busy doing the legislative update,
Exactly.
which is a good reason to miss Maddie today. I'll also say Connecticut is unusual, if not unique, in excluding these kinds of workers from the paid leave program in general, particularly those working in private schools. And so it is exciting to see Connecticut moving in the right direction on covering more folks in education as we continue to work towards covering everybody. So excited to see that. I see Justin off mute. Did you want to jump in?
Yeah, I just wanted to say the substitute language, I think it makes sense. Someone who's in public schools all the time in my job. I see a lot of para educators that have teaching certificates, but don't feel that they're best fit for a classroom, but are more fit for a one-on-one para. And so I do think that would be a logistic nightmare for districts to figure out who is actually eligible and who isn't. So whoever proposed that substitute language, I think it will really make the burden less onerous on districts. So smart move.
Great. Thank you, Justin.
Other thoughts or questions on the legislative update? Okay. Then I will move us over to Jessica, and it sounds like we're going to tag in Rebecca soon to hear about the MDRC partnership for focus groups and surveys, but I'll turn it over to Jessica.
Thank you, Molly. Good morning, everyone. So we have been meeting with Rebecca and her team over at MDRC for the past couple of months, just doing some initial kind of brainstorming. I'm going to let Rebecca really introduce MDRC, but essentially they are a nonprofit bipartisan organization that looks at different programs that particularly affect low-income residents and ways to make improvements to those programs to make them more accessible. So we initially had started talking with Rebecca and her team about some of the challenges we see with denials due to documentation issues and how they may be able to help us with some research in that vein and how we could make improvements to our program to try to lessen that challenge. So I'll turn it over to Rebecca, and I know she has a slide presentation that she'll share to go into more detail both about MDRC and the work that they're proposing to do on our behalf.
Fantastic. Thank you so much, Jessica. Great to be here. And I have been coming to these meetings for several months, and I really love how, public and transparent Connecticut is. I've been working with multiple states in the paid family leave area. So just want to commend you for, I really love these public meetings. Happy to take any questions at any time, but I'll run through, as Jessica said, kind of who we are, my organization, and then what our plans are currently for our partnership with Connecticut. In terms of who is, or I should say, okay, our project is called Using Behavioral Insights to Advance Paid Family Leave Programs. And this project, I will say, has private foundation funding. So we have been approaching a lot of folks, including I have met separately with Molly, both in terms of national stakeholders and the 10 states in particular that currently have mandatory paid leave programs, plus the 4 more that have passed legislation and are coming online soon. And so who is MDRC? Great job with the letters, Jessica. My dad does not always get them. I wanted to clarify, I think a really important thing about MDRC is that its legal name is MDRC. So it used to stand for Manpower Demonstration Research Corporation when it was founded 50 years ago by the Ford Foundation. And then in like the 90s, they decided that was not a great name, not very inclusive. And also we've expanded beyond workforce, although I think paid leave is in the workforce domain, but we really work from, starting from pregnancy through adulthood, as Jessica said, trying to understand how programs do serve low-income individuals and families and how they could continue to better serve them, and really understanding through a variety of techniques, both researching sort of learning what's happening and what the impact of different policies are, plus partnering with what we already know works based on a lot of evidence that we personally have gathered and that we read about, and trying to help state and local partners apply the best evidence that we have. So the Center for Applied Behavioral Science is a unit within MDRC, and we really focus on walking through processes from the customer perspective. I mean, in paid leave, there's multiple customers. There's the employees, the employers, but I think in particular, we've talked a lot about the employees, and sort of trying to understand, you know, what is their experience now, and are there ways it could be improved. And this slide is also just to say that we've worked, you know, with a majority of states across the country. And I think the key thing that we try to do is partner in the truest sense of the word, where we're not coming in with specific solutions or even goals. We really want to work with our partners, which is why Erin and Jess and the team have been so great. So we do work, since we work with low income individuals, we work on the sort of gamut of benefits programs. And this is where it's showing that paid family leave is the one we're focusing on for this project. But we have worked in all of these areas. I particularly have worked a lot in TANF and Head Start, as well as SNAP employment and training. So our process generally, and I would say with Connecticut, we are in the understand our goal section. So we try to understand and then design ideas and then learn from those ideas and have continuous feedback. I will say, again, to their credit, Connecticut is doing a lot of this, as you all know, without us, sort of a real system of continual improvement that we don't see as much as we'd like to from government partners. But we are still in the sort of understanding the goal. And we think it's really important to try to understand what's going on before just jumping to solutions, because you want even if the solutions are really pretty and shiny or like a new form, you want to make sure that that's actually targeting a challenge or a barrier that people are having. So I'll just give one more background slide and then jump into what we're doing with Connecticut specifically. So most programs, this is really the heart of what we do, are designed as if people are rational. So that's saying we're going to give you information, you know, the sort of eligibility or publicity or the annual notice employers post. And then you are going to sort through that information and make a decision about whether this program is right for you. And if you do decide it's right for you, you will apply and take action. And that's how across the board, most programs are designed. But in reality, we know that we're human beings, all of us, and there's lots of things that happen along the way. And these are really where the Center for Applied Behavioral Science tries to understand what's going on. So we would consider these what we call sort of behavioral factors as opposed to structural or policy factors. So part of our understanding is to try to see, like, within the people who are eligible under, you know, the way the policy is written, where are these behavioral factors happening? When you talk about information, we know across all states, there are some people that just never even know they're eligible. And then, you know, what about just sort of everything else going on in their lives, especially with paid leave? We know that it's usually a time of, you know, of intensity and often of crisis. And then again, decision to action. So even if you know that you're eligible, you think it's a good fit for you and it's the right thing for you to try to take, then we just know. And this is where I think we are kind of getting into, once you're sort of in the process, you've dipped your toe in, or maybe you've started a claim, then there's a lot of stuff that happens. You know, I can say about my own like goals around going to the gym, right? Like I have very good intentions, but life happens, and we all kind of procrastinate, and, you know, change is hard. And every extra step with the hassle factors, I will say every extra form, every extra step, every extra click, you're going to lose some people. And just thinking through that. Okay, so with Connecticut, as Jess said, we've aligned on this goal that feels very aligned with work we've done in other domains and with other partners, of saying the paperwork, sort of the devil is in the details. The paperwork really matters. And I have to say, I think that Connecticut and Aflac's forms are prettier than most places. And like they do seem, when you look at them, pretty intuitive. But the way that we really are going to know what's going on is by talking to the people who are not successfully completing those forms. So the key point of surveys and focus groups is to gather information that we don't have from available sources. So you do have, and especially Aflac has, you can cut data quite a number of ways, but in terms of that map that we went to, this is the part that the data usually doesn't really reveal. You can make educated guesses or hypotheses. So what we're planning to do, since, as we said, we work with our partners and Connecticut wants to understand, what's going on with these people who are starting a claim, and it is by far the most common denial reason. Also, as a caveat, or as an asterisk, as you probably know, in other states we work with, they are actually less transparent. So the fact that people are denied, like many states, they wouldn't even be considered a claimant, and they wouldn't be tracked if they hadn't already submitted like a required employment or medical form. So I will say Connecticut is, again, being more transparent. And as a behavioral scientist, it's very exciting because we can actually see the people who get to step 1A and not step 1B. And that is something that, again, a lot of states are not forthcoming with. So I want to commend that. So yeah, so basically the best thing that I do, I think, is just help people say, well, if you want to know what's going on, how can we talk to those people? And so that's why we're planning to do first a short screener, and then for those who opt in, a paid Zoom focus group. So in terms of what MDRC brings separately is, in addition to sort of the research background and doing this a lot, we are, I think, independent. So although the initial outreach comes from Connecticut, everything from there is done by MDRC. And so we would not be sharing names back with Connecticut. We have our own institutional review board, which, just because we do a lot of research to make sure that we are telling people exactly kind of who they're talking to, why we're doing this, making sure they know it's voluntary, and telling them that we're going to, keep this separate. So it's really important that we will emphasize at every step that this has no bearing on their claim. And then we can also say, if you want to talk more about your claim, here's the number, or here's the best way to do that. But we do not work for Connecticut. And so we also are able to provide gift cards to thank people for their time, which is something that's built into our budget. And then every step of these are what we call opt-in, right? So Connecticut already has the list. People have already given them the information of their email, and some basic data points. And so Connecticut will do the screen. We don't see that list because that's private to Connecticut and Aflac. And then it's only people who say, yes, I want to click on this link to do the survey. And then if they go to the survey, there would be a first page that also, again, explains who we are and what this is. And then we go from there. And then the last slide, and then I'm happy to go back and answer any questions, is, again, just to emphasize again, we're trying to get information we don't have. We're very excited. We think that this will be, really interesting and useful information. In particular, as I've learned more about this topic, that a lot of you know a lot more than I do, we just don't know when people start a claim and don't turn in all the documents. Some of them, they may have ended up going with their employer. They may have had a change in their situation. They could have moved, right? There's so many things we just don't know about why they didn't continue the paperwork. And then so the first one is just kind of what I would call sort of structural reasons. They weren't actually a good fit, but we just never knew that. Versus the last three, which are more in the vein of understanding like what people know and don't know. And then, what were barriers or facilitators to talking to their employers? And then also what barriers and facilitators might they have had with the other forms. So we're excited to learn. And so even though we don't share names, we would be synthesizing and sharing back the information and insights, and then working with Connecticut to see from there if there's any, how we can continue to be helpful. Okay, any questions or any slides anyone would like to see again?
Thank you so much. I have thoughts, but I want to make sure other folks get a chance to jump in if there are other questions or flags. Just flipping back and forth in the Zoom. But I want to say I think this is fantastic, and I just want to lift up that I think this research specifically targets something that we know is like maybe the greatest room for improvement in the program. Like we know that there are lots and lots of people who are starting a claim and then getting denied because they're not putting in documentation and understanding why that's true and how we can help people and how we can make that easier. And I think identifying why that's happening is something that we know has been a challenge in the program from the beginning. And so seeing this thoughtful and targeted approach to trying to resolve and improve that situation, I think is exactly the kind of stuff we should be doing. And I'm really glad to see the authority partnering with a partner who can help us do that kind of work, since the authority staff is experts at many things, but like formal focus group research, I don't think is an expertise of anybody on staff. So excited to see this happening and excited to see sort of what turns up. I also wanted to ask, the team at New Practice Lab at New America has done, they're wrapping up, actually they're presenting on it on a call I'm on this afternoon, about documentation in the Minnesota program. And they're approaching it differently. They're starting from a program that's not fully online, but I was curious, since you're both focused specifically on documentation, whether you were already in touch with those folks.
Yeah, that's a great question. Oh, sorry, Erin, were you?
No,
gonna-
you go ahead, Rebecca.
Yeah, I do know those folks. And so, yeah, I actually met with them recently. And they had published some work on this. As a researcher in this space, I will say, like, for paid family leave specifically, there is the fact that there's really only one other small nonprofit doing this work. And as you all know, I mean, the more I learn about this program, it is like an incredible program and really important for income smoothing and for improving the lives. It's an incredible benefit, and the fact that some people are not not really getting through the process, is worth exploring further. Yeah, so with the New American Practice Lab, New American New Practice Lab, we are, we're in touch with them. So they published some work on New Jersey that they did in like 2018. That's the only, I think, published work on this particular sort of going through why these things are important. We are keeping in touch with them. They're also doing some like longer term work that they're trying with the medical field. In particular, I think they're interested in like technology solutions with someone like Epic, like a big provider, which is just like a very in-depth long-term project. And they also, yes, and then Minnesota and Maryland, we're also going to be doing some work probably with Maryland as well. So yeah, I think their work, I think it's all relevant. It's just, I think it's this combination of these principles and the evidence being kind of universal, but also so context specific. And that's why, as we know, every state is designed so differently, and every population, is different, but especially just the way the state programs work. I think it's a yes and where we want to understand and use best practices that are happening across all the states, but also recognize that Connecticut, especially with the way that I'm interested to see if people even really understand the paid leave, Connecticut paid leave versus Aflac, for example, and how those two interact, so that's an area that's unique. I don't know if that answers the question, but yes, we are in touch with them, and we would love to keep working with them, learning from each other.
They're also, from what I've heard from Minnesota folks, they're focusing a lot on medical provider behavior, which is critical. In over half of our claims involve specifically serious health condition, and then you get on all the pregnancy and the caregiver. We're dealing with doctors and their staff a lot. But because they're working on that, we really wanted to look at the claimant behavior. So I think that there'll be some really great opportunities for synergy, but we didn't want to duplicate their efforts. It's also the Connecticut medical world in the world of electronic medical records within Connecticut is different and special. And so some of the things that other states may have, we don't necessarily have comparable situations.
That's helpful. And yeah, I think the flip side of Connecticut not doing the same work Minnesota's doing is Minnesota can't do this work that Connecticut is doing because Minnesota doesn't have claimants because their program is not up and running yet. And so I think there's most importantly, huge potential value here to Connecticut claimants and to making the Connecticut program stronger, but it also seems like something that's going to have useful learnings and implications for folks in other spaces. Since I will say, as someone who lives and breathes this is the thing that we know is a challenge everywhere, and there's just nothing. There's almost no research on it. There's like that one paper and a lot of like anecdotal stuff, and so building out in a more focused and research-based way, how do we do this better and how do we do this in a way that gets workers what they need is, I think, incredibly, incredibly valuable. And I'm excited to see Connecticut in the lead.
Yes, actually, this is Isha. I'm driving, so it's hard for me to raise my hand, so I apologize if I'm just jumping in. But thank you, Molly, for those comments. I second that and very excited to hear about this work. I'm very familiar with the term I use is user research, but is all behavioral. And so my comment is more about, as we go through this process, you know, it's not typically a one and done. It's, you know, how do you help enable and create that sustainability with the authority to periodically do these types of focus groups to check in on the minds and you know, the mindsets and behaviors of our clients who are or claimants who are applying for benefits because things do change over time. And so my experience has been, you know, I'm primarily operations and technology. You do this work when you're installing a new system, and then 5 or 10 years goes by and you're wondering, well, why aren't we getting the outcomes or the uplift that we need specifically with documentation? So being able to do this periodically and make it part of the DNA of the authority, I think will be helpful going forward.
Thank you, Isha. I think if you were looking at the screen and not driving, you would have seen a lot of nodding. So I think that's incredibly helpful, and it's always useful to bring in the context from other places. Anyone else with thoughts or questions? I see Ava's hand up.
I just wanted to highlight that it's pretty impressive, you know, like in this committee, we're always trying to figure out how we're better engaging, how we're better making sure that we're doing the outreach that needs to be done, and just hearing the perspective and how you really define that work and then like put that into practice, making sure that communities understand what's happening. It's good seeing other perspectives. So I just wanted to thank you for the presentation.
Thank you, Ava. Anybody else? Also share, I looked to confirm the number because I couldn't help myself, and it's 72% of denied claims are denied for something to do with missing medical documentation. So like that's a huge, huge chunk as we think about how do we get to as close as we can get to everybody who needs and qualifies for this program is able to get it. So really excited to see how this looks forward, and thank you so much to Rebecca and the team at MDRC, but also to, I'm sure there's lots of folks on the authority staff who are also doing a lot of work to support and engage this project. With that, we're going to go into sort of a more traditional update, and I think Jessica has our outreach and engagement updates.
Yes, thank you. Thanks, Molly. And thanks again, Rebecca, for joining us and sharing this information. All right. So I think this is my first time doing an update where I had 2 months in between. So it was, I was like looking back and trying to make sure that I captured all the things I wanted to talk about without providing duplication. So just wanted to first start with an events update. Obviously, the late fall and winter are slower times for us, but we are starting to ramp back up. So I just wanted to give a snapshot of the couple of events we had in January and February, and then as you can see, starting in March, we're really ramping up. So we continue to participate with the Small Business Administration with their business resource fairs, which move around the state. So Nancy was at one of those in Torrington earlier this year. We also tabled at the Solid Ground Farm Manager Summit in Hartford. That was in partnership with UConn. Excuse me. and we were at the CBIA HR conference. Just this past weekend, we were at the Black Family Wellness Expo in Hartford. And yesterday, Nancy was there tabling and Erin was there as a guest for the CBIA When Women Lead event. So that was a great event, the first that we've done of that particular type with CBIA, and you know, heard some really great feedback. Tomorrow and Saturday, we will be up at UConn, the Storrs campus, for the True Colors SojiCon event. This is a 2-day conference and resource fair for LGBTQ community and their supporters. And I'll be doing a presentation on paid, so we're excited for that. We also will be at the community baby shower taking place at CCSU in New Britain coming up in a few weeks. Tabling at Adrian's event in the company of women. So that's something we do every year. It's always a great event, and we love to be there. And then at the end of April, we'll be at the Tri-State SHRM Conference at Mohegan Sun, and actually our own Michael Caesar will be participating in a panel presentation with Spring Consulting Group on paid family and medical leave in multiple states, but he'll be representing Connecticut. So we will be there as well. And then rounding out April, the Small Business Administration Resource Fair in Groton. So next time we meet in 2 months, you'll see another probably even more extensive calendar, as we are really starting to build up our event list for the springtime. I wanted to highlight a partnership that we've been working on with the Judicial Branch Office of Victim Services. We've met with them several times over the past couple of months in order to really highlight one of the changes that went into effect in October that essentially clarifies or makes it possible for folks to get compensation both from Office of Victim Services and from Connecticut Paid Leave if they were victims of crime and are experiencing a serious health condition or needing safe leave, etc. So we're working on a couple of things with them. One is an op-ed, which we'll be pitching to local publications with the hope of getting it published during National Crime Victims' Rights Week, the second week in April. And then I won't talk much about it because I know Nancy's going to give her update, but we'll also be partnering with them on a podcast. So we're always excited when we can partner with other state agencies and entities, and we're excited about this new one. I also wanted to highlight that back in February, Erin had 2 media appearances. These are both linked, so when you get the slides, you can certainly watch if you did not catch them. But she was on WFSB on their Great Day program on February 10th. This is actually Erin's 3rd time on the program. And it's always great because she's able to just really, again, disseminate that information about who we are, what we do, how people can access the program. And then was also on WTNH Channel 8, and that was her first appearance there, although we hope not her last. So we're keeping Erin out there in the spotlight talking about the program as much as we can. I also just wanted to highlight, Nicole continues to do really great work in making connections with community organizations, employers, small businesses, really just reaching out, making an introduction, doing a sort of initial meeting to learn more about them and tell them more about our program. And that's led to, in just the past month, a number of trainings or presentations to various organizations. So I just wanted to put the list here. You can see it's very diverse, from nonprofits like Junta for Progressive Action to employers like Diageo, to the YWCA of New Britain. So I really wanted to highlight that she continues to do really excellent work connecting us with groups that we may not have thought to connect with previously, and really allowing us to have those one-on-one conversations with folks who not only may need the program for themselves or for their employees, but also are working with populations that they can then help guide through our program if they need assistance. Also just wanted to make a quick note. We haven't talked about it in a little while, but our Paid Leave Spotlight, which is something that Amber has been heading up for us and doing a really amazing job producing new content. So we've really grown in the past year. We've produced and published 14 videos on all different kinds of topics. And because we have such a diverse library, we decided we needed to organize the information better on our website so that folks could find what they were looking for quickly and easily. So we've revamped that page. There's just a screenshot here, but so you can go ahead and take a look at it if you'd like. Again, just trying to really make it very intuitive for folks to find what they're looking for. And the two newest videos that we have posted are on caregiver leave and safe leave. So wanted to shout out Amber for her continued great work on that program. And then lastly, I just wanted to highlight two additional projects that we're working on, which are, maybe a little bit out of the realm of sort of our traditional outreach and engagement. And I wanted to really thank Virginia, who has stepped up to help us with these two projects. One is PDF accessibility. So reviewing all of the PDFs on our website, which are quite numerous, to make sure that they are accessible and they comply with the accessibility standards that we need and want to comply with, making any updates that are necessary so we can ensure that the information we put out there really is available to everyone, regardless of how they are consuming the information on our site. And then lastly, I wanted to point out that this is sort of a joint project that we'll be working on with IT, but looking at our contact us data and really just trying to identify any trends. Are there common reasons people are writing in? Is there a disconnect between what reason people are selecting from our drop-down list and then what they're actually asking about? So Virginia, who's really a whiz with data and Excel and kind of analyzing information, is looking at that to identify those trends. Then that will help us not only figure out what topics we may need to develop some new outreach materials or new approaches to, but also ultimately hoping to make some adjustments to the contact page as a whole holistically, but also the form specifically to make it more user-friendly. So the whole team is working really hard on a number of different things, and I just wanted to make sure that I highlighted and gave credit for all the great work that our team is doing. I'm happy to answer any questions.
Thank you so much, Jessica. Any questions for Jessica?
No questions for Jessica, but just a comment on and to say thank you for all the great work. This is truly fabulous to see what the authority continues to do with outreach and engaging, families and our committees of cognizance. So thank you for the great work.
Echoing those things, and also I appreciate that this committee, I think, always does a great job of lifting up the ways in which the whole team is supporting all of this work. So the ways in which we are collectively reaping the benefits of not only the work Jessica does and the work that Nancy does, but the work that Maddie is doing and the work that Nicole is doing and the work that Victoria is doing, and like how all of these things fit together. Because it, I think, is really this is the work that I think sometimes goes a little bit unsung. But it's a thing that the authority has invested a lot of resources and capacity into for a reason, because it's essential to achieving the goals we're all trying to achieve. And I want to make sure that we're always lifting up all of those pieces here. Anything else for Jessica before we move on to podcast updates? Okay, take it away, Nancy.
Good morning, everybody. Let me share my screen here.
We can see your screen, Nance.
Okay, I'm just gonna get into present mode. Okay, so the Paid Leave podcast, we're doing March and April guests and topics. And so for March, it is World Down Syndrome Day and Developmental Disabilities Awareness Month. And my guest was the CEO of the National Down Syndrome Society, Candy Pickard, and she has a son, Mason, with Down syndrome. So her story was just super compelling. And when I asked her a question, what advice would you give new parents who have a child that got diagnosed with Down syndrome? And she said, I would say congratulations. I mean, she was such an interesting, wonderful person to talk to. And we're going to try to do more with their national program. So I'm talking to their people, and hopefully we'll get on their newsletters, and we'll get that national exposure that we're hoping for. And coming up in the next podcast this month is LGBTQ plus Health Month. And Bill Elias is the administrator and law fellow with the Commission on Women, Children, Seniors, Equity, and Opportunities. And he leads the LGBTQ Justice and Opportunity Network. And so that will be going up at the end of this month. And turning to April, it is Sexual Assault Awareness and Prevention Month, and also Sexual Assault Awareness Month Day of Action, which is April 2nd. And tomorrow, I'm actually talking with Mark Pelka, who is the Office of Victim Services Deputy Director, and Rachel McKnight, the OVS Program Manager. And I usually meet with the guests prior to doing the podcast, because I like to have, there's a comfort level there, but also information gathering. And I just didn't know how much they do. There's so much that OVS does. So I really think that that's going to be, and I just really like them. They're really smart. And I think that will really help a lot of people. And they have like fiduciary programs, right? So they have compensation programs. And I didn't realize that also covers car accidents. Like if there's a DUI and someone dies in it, and the family can go to them and get support. So it was a really, they're a really great program. So I'm really excited about that podcast that we're going to be doing tomorrow. It's also Parkinson's Awareness Month. World Parkinson's Day is April 11th. My guests so far are Holly Seymour. She's the program director of the Connecticut American Parkinson's Disease Association. And she's bringing a caregiver with her, Heather Pierce, and she looked after her father after his diagnosis with Parkinson's in 2019. And I had the ability to have someone who had Parkinson's on. He was a friend of mine, but in talking with him, Parkinson's is really interesting in how it affects people. So I just didn't feel like that was the best way to go. And I thought caregiving was a better way to go, because they can be inappropriate, and trying to rein them in is difficult. And I just didn't want to expose him to that. I just didn't feel, his employer doesn't even know that he has Parkinson's. So we'd have to use like an alias. And I just didn't really feel like that was the strongest way to go with it. So we're going with a caregiver, and I'm still working and trying to find out if the Michael J. Fox Foundation will be joining us as well, so we can get that national aspect of it. She said yes, but we're having difficulty finding the guest that she wants to do that with. And we hit 75 episodes, which is really great. Very proud of that fact that since February of 2022 that we've had 75 episodes. So excited, and we have 7,090 downloads and 988 downloads in the last 90 days. And that's pretty significant. And we do cross promotion, and Jess will understand this, talking radio, but we do a cross promotion with another one of our interview programs and segments that Nicole really spearheads. It's 5 Minutes of Impact. And at the end of my interviews, I always say, for a deeper dive into Connecticut paid leave, please listen to the Paid Leave podcast on our website. It's at ctpaidleave.org. And those kinds of cross promotions are really good. And I'm thinking that maybe we're getting a little traction from other people tuning into the podcast with that, because it's pretty significant, 988 downloads in 90 days. So I was very pleased with that. And you can find the podcast on the Connecticut Paid Leave website, our YouTube, and all platforms that you find podcasts. And the most popular ones are Apple, Spotify, Google, and Overcast. So please like and subscribe. I would love you to do that. And thank you for your support with the podcast. I appreciate it. And if there's any questions, please let me know.
Thank you so much, Nancy, and congratulations on 75 episodes.
Now we have to wait till it's 100.
Yeah. I feel like we need cake when it's 100. Like I feel like 100 episodes is a cake occasion.
I love cake, so I'm all
questions?
for that, Molly.
Yeah. Any questions or flags for Nancy? Okay. Hearing none, is there any old business anyone would like to raise? Is there any new business anyone would like to raise?
It's not new business, but I just want to say it's really great to hear how much this agent, what we're doing, like it touching so many different areas. And it's, I just want to give kudos to the staff and trying to think outside the box. And I know winter can be a little dormant for all of us. And so it's good to see the event starting back up, people coming out. Went on a walk yesterday, love seeing people out at the park. And I think we'll have more opportunities to engage people as the weather gets nicer.
You're here, and summer health fair season will be on us before we know it.
Yes.
Any other new business or anything else folks would like to raise? Okay.
I
Do we
have
have a motion?
just a quick
Go ahead.
question, or I guess a comment. To add things, events on the list that might not be on the radar, Jessica, is it best to connect with you?
Yes, please. If you can send them to me, we meet every Wednesday and we review all sorts of proposed events that we've come across. So we would definitely welcome any suggestions.
Okay, there's some timelines here for tabling events coming up in May. I know there's Latinas in Power. I think it's coming up next week, and there's also the New Haven Stroll for June. But their submissions to table are closing pretty soon, so I'll connect with you offline.
Great, thank you.
Thank you, Ava. Anything else anyone would like to raise or flag? Okay. May we have a motion to adjourn?
So moved.
Thank you, Justin. Do we have a second?
A second is Isha.
Thank you, Isha. Any discussion of the motion to adjourn? Hearing none, all in favor, please say aye. Aye.
Aye.
Aye.
Any opposed? Any abstentions? The motion carries. The meeting is adjourned. It is 9:49 a.m. Thank you so much to everybody, to the board and the staff, and to everyone for making all of this work. We will see you in 2 months.
Thank you, everyone.
Right. Bye-bye.
Yeah.